Hello, how are you? I trust that you're all doing fine. You're most welcome to our YouTube channel, Angel's Eye Optical Center, Mbarara. We are pleased to bring you our other common eye condition, refractive error condition, which is hypermetropia. What is hypermetropia? It is commonly known as long-sightedness. So, with the long-sightedness, the patient or the complainant, the patient or the person who has the eye problem may complain of seeing things that are far very well, but straining to see things that are near. So in this case, somebody who has very high hypermetropia may also complain of seeing poorly, rarely vision for all distances. Even when it is near, they are not seeing. Even when it is far, they are not seeing. So that is hypermetropia. Hypermetropia is believed that it is as a result of a very slightly less curved cornea. And we remember we said the cornea is the black part of the eye, which is normally clear. So you might find it should be a bit round, but now you find it is very slightly curved. So it is not very steeply curved. It is not round as it should, but it is almost flattened. It is very thinly or lightly curved. Also the lens inside the eye is also lightly curved. So the other condition that can make you to have hypermetropia is having a shorter eyeball. Remember in myopia we said it is longer eyeball, but in hypermetropia it is a shorter eyeball. So the light rays are formed beyond the retina. Of course, basically that one is not very possible, but the ends don't meet completely where the point where it should at the retina. So if it has gone beyond the retina, so you find it is far from the retina, thus the farsightedness. What are the symptoms of somebody who is suffering from hypermetropia? There is the very common one, blurry vision for things that are near, headache, the need to squeeze the eyes or to strain when seeing, headache, and another one would be squinting. Have you seen eyes that are almost crossing each other? Yeah, that might be a sign that you have hypermetropia. The other thing that would a person with hypermetropia may complain is fatigue at the end of the day. After doing some near work, you find the person is so tired, and they might even have very severe headache in the evening. Hypermetropia is corrected with corrective glasses, which are glasses like these ones with that prescription that once we check your eyes, we will find this is the lens power that you should use, and we give you. The other thing is surgery, which can be either laser surgery, and they are in different categories, which is beyond the scope of this topic of today. So you find that most of the times people use either contact lenses and prescription glasses, eyeglasses. But mostly we still use eyeglasses because eyeglasses are easy to maintain and they don't put you at any risk factor like an infection as you find in contact lenses, and they are also not very expensive. The contact lenses you might find for a month, for 8 months, for a year, and there is that risk factor of having an infection because the contact lenses we put them on the eye. But maybe on special cases like you have your wedding day, you didn't want to have the glasses, we can organize for you the contact lenses. Even for people with myopia, we can do the contact lenses and even surgery. But surgery, of course, it has its own risk factors, and we are going to cover about the complications that you might get after doing a refractive surgery. The one that is meant to correct your refractive errors. We're going to look at them at a later time. So what are the complications of somebody who has hypermetropia? They are similar to those ones of myopia, and you find that the person is putting their life at risk just as they are putting the life of other people at risk. Because if you're not seeing something that is near very well, you might be somewhere walking and you hit something that hits another person. If you're driving, you might not see a car that is very near, or even a pedestrian who is crossing the road. So you'll have killed a person or injured a person, and even you yourself, you might end up hitting a car and you also crash in your car. So the risk, the worst risk is the safety of that person. The other thing is inability to do your cross work. You are not able to do the daily tasks. For example, if you're doing the work that requires you to do a lot of near work and you get headache at the end of the day, you actually get a lot of discomfort. What happens is that you might not be able to be effective or productive. So those are some of the complications that you get, and also eye strain. That is only when you have not corrected. But once you correct the hypermetropia, you are able to see very well and to lead a normal life. People who have used glasses have testimonies to say that I used never to see very well, but nowadays I do my work very well, and I am doing, you cannot even tell. I actually feel so productive, and I am very effective at my work. So those are the things that we wish you to know about hypermetropia. But if you have a question, feel free to ask us on the comment section so that we can interact. And also, if you have something to add, please feel free to add. Thank you.